We're so pleased to have with us today Dr. Mark Chang of Ballad CVA, formerly Wellmont CVA Heart Institute, and Adam Klein of ECG Management. They are presenting here at the MedAxiom conference on innovative compensation models. So thank you both for being here. Appreciate your time. So Dr. Chang, once you had this new innovative comp model designed an agreement on it, what were the elements that were in place to allow you to move forward with it and actually get it launched?
Well, we had, I think, a very favorable local and regional environment. I think it starts first and foremost with the culture and governance structure of our group.
How would you describe that?
I think a very uniform, like-minded collection of folks whose priorities about where quality of care and governance versus income fell on the priority list for us as individuals and as a group. I think the regional environment was competitive enough to provide that incentive for people to work hard and change in response to the external challenges. And I think that was true of our hospital administration that we were working with as well. So I think there was a lot of momentum and incentive and structure in place on both sides to do something innovative, do something forward-thinking that was going to represent a pretty significant change for both administrative folks and for the practice.
Wonderful. Adam, from your perspective, you work with a lot of different healthcare organizations and you see challenges that they face. With that in mind, what do you recommend for ways for them to overcome these challenges and take these first steps?
Well, there are some general guidelines to consider. The background and circumstances are so relevant to what somebody ought to do based on what they can do, and your governance and management system probably enables some solutions that might not be available immediately to your peers. But what I find important to consider up front is that anytime you make a change, notwithstanding the fact that everybody hates change, there are going to be winners and losers. And those things are going to play out in a number of ways that the effect can be mitigated with excellent communication and an understanding of what it is that we're trying to accomplish with this change. The fact is that when you actually play these things out and implement it and somebody sees a pay cut, they're not going to be happy about that, and they're probably going to find lots of reasons why that doesn't make sense under the circumstances, but it's simply unsustainable to think that you're going to implement a compensation plan change that nobody gets a pay cut on, because that would just be a massive increase in cost, and that's the problem that we're trying to solve. So creating a set of stakeholders, identifying the objectives of the organization, and communicating all the time, providing a feedback and input loop that's constant. There are as well, sorry.
May I ask you just to go a little bit deeper on that and ways to communicate within an organization? What have you found to be effective? And maybe if you have an example as well, Dr. Chang, about what we're getting together in groups and discussing. I mean, there's so many ways to communicate these days. What's most effective with a change like this?
Well, let me just clarify. So I'm still answering in the context of getting the new plan started. I think Adam is answering from where do we go from here, and maybe the future outlook looking bleak and expecting a downturn as some of these deals get reassessed for mutual value versus an unequal outcome. Is that?
I think that's fair. I mean, so the starting point I thought for the question is where is step one, and so step one is probably recognizing that you've got problems and you're not going to be able to fix all of them, so you have to...
Whether that's now or back then.
Whether that's now or back then.
Okay, I get it. Okay.
And if those problems are we're paying too much money to doctors and they're not doing enough work, that's very different than our doctors are so busy they're making more money than we'd ever anticipated. And it's a very different solution set. If the problem is we've already migrated into a value-based reimbursement system, but now our compensation system is at odds so that we're working cross purposes with our physician partners, then that's another set of challenges.
Right. But I think, you know, as far as communicating goes, it's made me think a lot about opposing or very different kinds of styles, all of which can be effective. And I think on one end of the spectrum, if you really have a small number of strong leaders who make all of the decisions that everybody in the remainder or the organization just accepts and lives by, all the way to a full democracy and everything in between, I think in a very difficult, sensitive, changing environment where highly personal values are at stake, income, lifestyle, professional satisfaction, scheduling issues, who has control over what sorts of decisions that impact all of those things at an individual and group level. My own feeling is it's difficult to accurately assess, even partners that you know very well, what their personal reactions to these sorts of changes are going to be. My own solution is to just simply flush it out and talk about it as directly and as maturely as possible and try to arrive at a consensus. I'm biased by the fact that I think we have a collection of high-minded individuals who actually are able to handle this information and come to a group collective decision just because of the culture that had been built for the prior 30, 40 years.
So I think that's a key element in that there's the old joke about the platypus being God's attempt to work through committee. The idea of trying to please everybody means that you end up pleasing nobody, and so in your organization you had the ability that as a starting point there was a culture and a vision that was relatively shared.
Yes.
And where that's not the case, it's important to surface it, I think, we found. Because if you don't, then you're going to be blindsided by the range of objections, all of which are probably correct given their perspectives.
Right, right, agreed.
So what I'm hearing is that there's not just one answer for these questions, that it's individual to the organization and the culture and how very different that can be across healthcare and cardiovascular healthcare in general. And so I appreciate you sharing how it worked for you and how you all approached it, and I wonder if you have just a concluding statement on how, when you're working with your clients and approaching different healthcare organizations, again, communication you said is very important. Is there anything else to really that you suggest people focus on as they're approaching this complex issue?
Yeah, I think the most important thing for people to be aware of when they're redesigning compensation plans is to take the benchmarks with a huge grain of salt. These are data sources which are, whether or not you think they're representative, are backward-looking. At best, we're looking at data from arrangements that were put in place 2 years ago, and we're trying to create the model for the next 5 years. We're probably not going to get that answer looking backward. And so we need to find new ways to think about the data and what is fair and reasonable to do under that circumstance.
Okay. And that has great application.
So I just wonder what sort of, it's a fascinating point for me because all we really have are the backward-looking data. And so I wonder what sort of modeling and forward-looking information you are looking toward as you try to put that together for your clients.
It's not a lot different than the kinds of information that hospitals are looking at for their strategic planning process when they're trying to understand markets and market share and physician relationships. So the best data sources today frequently are 1 to 2 years old, and there is tremendous interest and momentum behind big data and getting real-time complete information. The same phenomenon exists in the world of physician relationships and compensation. And the peer-to-peer data sharing and crowdsourcing of information is starting to emerge, and in many cases it's very hard and painful to extract this kind of information, but it's a fruitful exercise and it will get easier over time.
And all of that, either as a result of or in concert with unpredictable, dare we say, schizophrenic changes at the federal payer level, and that's going to set the stage for what actually happens. And despite all the talk about the changes over the past 11 years, we've actually seen fairly little movement in the flow of dollars. So it just seems to me an extraordinarily difficult, if not impossible, task to model accordingly going forward with all of the variables involved that are so much out of the control of all of the providers, whether it's hospital or physician.
And like you said, ever-changing.
Ever-changing.
Ever-changing, yeah. All right, well, I so much appreciate your time and your insights today. I don't know if we solved all the problems, but I really do appreciate your perspectives and your experience on this. Thank you so much.
Thanks, Tina.
Thank you.